Thank you for tuning in to our first video session. The topic is pain education, and we'll be talking about what pain is, what types of pain there are, what pain is to you, and lightly touch on how to overcome barriers related to pain. The purpose of this session is to empower you to identify your pain more and understand that you have the ability to control it. While it might not seem like a great strategy, the confidence you gain from understanding your pain more will help you overcome it and manage it in the future. During this session, we are first going to talk about the different classifications of pain and go deeper into what is actually going on inside your body. Then we'll go into the pain cycle, which is a great visual to understand your personal experience with pain and how to navigate the stages. Thirdly, we will talk about why pain is so debilitating, why it impedes so much of your function, and why it makes accomplishing daily activities so difficult. Fourthly, we will discuss the 4 themes of pain, which are different thoughts and mindsets people might have while living with chronic pain. Finally, we'll talk about understanding your pain and how you can manage your pain so that you can do what you need to do. Our first section is on pain classification. I'm sure everyone can think of a time we've been in pain. You may be sitting here watching this while you're in pain, but what exactly is it? And why do we feel it? Pain is actually a signal that is triggered somewhere in the body, and then it's sent up to your brain to interpret, then sent back down to your body to perform a certain action. Have you ever gotten something in your eye, like an eyelash or dirt? The eyelash agitates your eye and triggers the pain receptors in your eye to send a signal to the brain. The brain interprets the signal and recognizes that there is a foreign object in your eye and you need to get it out. In short, pain is a signal telling your body, danger. It's your body's warning sign or protective response that something is not right and that you need to fix it so you no longer feel the pain or discomfort. There are a lot of different ways to classify pain. This is helpful for both your understanding and when you talk to your healthcare providers. One of the main ways people talk about pain is physiologically, which refers to what's happening in your body. The 2 most common types of physiological pain are nociceptive and neuropathic pain. Nociceptive pain refers to the pain you often feel when your muscles are aching, you broke a bone, you got a cut or a bruise, stuff like that. While neuropathic pain refers to the pain as a result of weakness or damage to the nervous system. This can feel like numbness or tingling in your hands or feet, or shooting or burning sensations. Location is another way to classify your pain. I'm sure a healthcare provider has presented you with a body diagram and said, point to where it hurts, and you said, well, it hurts everywhere. Body diagrams are great for acute, short-term pain, but for chronic, long-term pain, they're not as helpful. Intensity is another way to describe pain. Healthcare providers often say, on a scale of 1 to 10, what is your pain level? Once again, this is great for acute pain, but not entirely accurate for describing the chronic pain experience. Finally, another way to classify pain is by time. This can refer to the time of day. Are there certain times of day that your pain gets worse or better? Are there certain activities that make your pain worse or better? This also refers to the concept of acute versus chronic pain. Acute and chronic pain are the most common classifications of pain you'll see. Acute pain is lasting less than 6 months, and some evidence will even say lasting less than 3 months. Acute pain is typically triggered by a specific event or activity, and often resolves when the injury is healed. Think of breaking a bone. It hurts and is painful until the bone heals. That's why the goal of acute pain is to cure the pain and make it go away. But sometimes acute pain doesn't go away. After 3 to 6 months, acute pain can transition to chronic pain, which is not always linked to a disease or injury, but sometimes it is. Chronic pain also does not respond well to traditional medicine, and the goal is not to cure it, but to manage it. When pain lasts this long, your body becomes used to it and begins to normalize the pain experience. There is a way you can work through the pain or around the pain so that you can manage it and complete your daily activities successfully. There are things that unite all pain experiences. The first is that it's real. What you are feeling and experiencing is very real and personal to you, and all types of pain can interfere with your day and lead to great discomfort, which can impede the things that you want to do. Moving on, we're going to talk about the pain cycle. The pain cycle is a great way to describe how pain can negatively impact everyday life beyond physically hurting. The pain cycle begins with the experience of pain, and because you're in pain, you may stop doing the things that you want to and need to do. This can lead to less moving overall, which can make your body unable to be as functional as you used to be. Your muscles can get tight and stiff and fatigued, which can result in more pain if you try to move. When you're not doing as much and not moving as often, a lot of times a psychological component comes into play. You may have a lot of negative thoughts, and that can spiral into not wanting to go out and not wanting to see other people. And when you avoid social situations, you continue to not move, and you might be scared to move. So your muscles continue to fatigue and stiffen, and the result is more pain. Even though pain is an underlying factor of the cycle, it is only listed on the cycle once. So yes, pain is a factor, but it is not the end-all be-all, and we want to empower you to take over that cycle and change it. Flare-ups are a common experience with chronic pain. Flare-ups are periods of intense pain that are more severe than what you typically experience on a day-to-day basis. This can be caused by a variety of things and may be unique to each person. Each person may have their own triggers, so to speak. It is important to manage these flare-ups, and each person will have their own tools and strategies to help them decrease their pain symptoms. When a flare-up occurs, it is important to have a set plan in place and be able to recall different strategies to use in the moment. When you know you're starting to feel more uncomfortable and your pain symptoms start to become more intense, sensing that a flare-up is coming, you can start to utilize the tools in your flare-up management plan to decrease buildup and stress. In future sessions and videos, we will be going more in depth on specific tools and strategies you can add to your management plan. But for now, here's a helpful hint that may be counterintuitive to you. Doing small amounts of light activity actually can help lower flare-up symptoms. A lot of times we think that pain means we shouldn't move because it might make the pain worse, when in reality, small amounts of light activity, also known as oscillations, will decrease your pain symptoms and keep your muscles active. An example is when you stub your toe or slam your finger in the door. You pull your foot or hand away and start to shake it out, and that helps distract you from the pain and helps the pain go away. The idea is the same with chronic pain. But why is pain so debilitating? Why does it seem to get in the way of so many aspects of life? Research has shown that pain is one of the biggest threats to quality of life. There are the physical aspects of being in pain, but remembering the pain cycle that we talked about earlier, there are a lot of components to pain and the pain experience beyond just the physical. The pain experience affects social relationships, how you feel about yourself, and what you think you can get done during the day. There are 4 common themes that come up in pain research. They refer to a psychological and social component when people think about and talk about their pain. The first theme is that pain is pervasive. This refers to how widespread pain can feel. Your pain experience may feel like it's always on your mind, and when you're constantly thinking about it, it's hard to focus on anything else. The second theme is that nobody understands. Pain can be hard to talk about with people because your pain experience is personal and unique to you. The third theme is I'm fine. When someone asks how you're doing and you don't want to explain everything that you're feeling, it's sometimes easier to just say, I'm fine. It's short, it's safe, it's neutral. And so you keep those emotions and frustrations inside. The final theme is pain is always a factor in the equation. Similar to the first theme, no matter what the situation you're in, you're always thinking about how your pain might impact your day. Are there chores that need to get done, but you want to meet up with people later on? Will your pain get worse throughout the day? Will you have to cancel plans? Pain tends to disrupt daily activities and plans, but the goal of this program is to help you develop strategies to manage your pain so that you can increase your activity and get back to what you need and want to do. So now that we've given you a little background about what pain is and different language you can use to talk about your pain, let's talk more about how you understand your pain personally. You control your body. Your body does not control you. This is a great mantra to keep, so no matter what your body is feeling, you can make a plan for managing your pain. It does not have to be this perpetual burden on you. It may always be a part of you and something that you've experienced on and off for a long time, but you can control it and you can manage it. Just because someone is experiencing pain does not mean that they cannot live their life. Here are some helpful hints to start, but over the next several weeks, we will be giving you more in-depth strategies to manage pain. These 3 areas, especially from an occupational therapy standpoint, are how we look at pain and how we look at overcoming it. The person, the activities, and the environment. First, the person, thinking about how you move. Whenever you're doing an activity or performing a movement, you want to make sure that it is done safely, slowly, and purposefully. We will be talking more about ergonomics and safe movements in another lecture, but you want to make sure that whatever movement you're doing has a purpose. In terms of changing what you do, let's think about your activities. Can you share the load with someone else? Can you take breaks while doing an activity? Can you break up the activity you're doing into smaller steps? When considering the environment, you want to set everything up beforehand and prepare before doing the activity. Here's an example of a strategy you can use at home to begin noticing when and how your pain interferes with your day. If you begin to experience a flare-up or increased pain, you can jot down when it happened, what you were doing when it started, and what, if anything, helped you feel more comfortable. This can help you notice patterns of flare-ups so you can begin to think about a flare management plan that would work for you. That's all we have for this week's session. Thank you so much for joining us, and please tune in to our future videos to learn about other strategies you can add to your pain management toolbox.